this is really exciting because this is the first time we've gathered people for this purpose. Really to talk about and think about what we want in terms of a chronic illness center for kids. So I'm going to tell you a little bit about sort of the work we've done so far and what our picture is of how this might be and what we're going to do today. And then we'll be able to do a lot of brainstorming and talking together, which should be good. And as I said, I'm a pediatric rheumatologist. I've been working at UCSF for 20 years, taking care of kids in the rheumatology clinic. And what I've come to notice is that we are missing a lot in our system, in our healthcare system. That we do a really good job at some things, but other things we really don't do a very good job at. And so I've had this idea in the back of my head for probably 10 years that we should create a center to bring people together to think about how we can do this better. And this is the beginning. The problem, what are we dealing with? Why are we here? So we know that there are more people with chronic illness. A lot of the diseases that we have are not curable, but they are treatable. So what that means is that they don't go away and you're just living with them. And the number of kids who have these conditions is growing. And we know it's tough on people. It's tough on kids, it's tough on the parents. And we want to do a better job. Our healthcare system is very oriented around what we call acute illnesses that are treatable in a short period of time and then are gone. But there's this other idea, this idea that it lasts forever. Now, a lot of people hope that they're going to outgrow their condition or someday there'll be a cure, and that all may be, but in the meantime, what do we do? And in the meantime, we have this idea that if it's lasting forever, we need a long view. We need to be looking at kids with a chronic illness and thinking forward through their whole life. What are we going to do with them if this doesn't go away? Our big goal is to help children with chronic illness achieve wellness over their entire lifetime, even if their condition is not cured. How do you do that? And I want to create a new kind of healthcare system that takes the long view. The solution is to develop a whole new healthcare system for kids with chronic illness. You didn't know you came to do that today. To create a system where providing the extras is normal, not the exception. You don't have to fight for the extras. That's just part of what we do. Where you have new approaches and that they can be shared across disease groups. I think a lot of what we do for one condition can be utilized in another condition, and that we have a lot more power in the world at getting people's attention, and it'll be much more efficient if we kind of think of things that are commonalities across different conditions. But the problem is all this requires research first, because we really don't know what works. Right? We don't know what we should do. We don't know what works. And so we need to do research if we're going to figure out what works. And this meeting is going to be the beginning of thinking about the research. So we may change our vision a little bit, but we're hoping that this is going to be something that captures really what we're trying to do. And I said we need to bring everybody together. So who are our stakeholders? Who are the everybody? This list probably isn't comprehensive, but you know, everybody who touches kids. And you know, patients and families are at the top, researchers are on the list, all the kinds of people in the community or in the healthcare system that touch these kids' lives. So why do we need patients and families? And I'm so happy that there's so many of you in the room. We need patients and families because patients and families know what the problems and worries are, right? I look at it through my lens as a provider. And I feel like I have a pretty good window into what my patients' lives are like, but I don't live with them. I don't really know. I don't experience it in the way that patients and families do, and I want that perspective here. I want to know what's most important. We could come up with a really long list probably of things to do, but we're going to somehow eventually need to prioritize it, so I want to know what's most important to patients and families, because I don't want to start with like what I think is most important. I want to start with what patients and families think is most important. I want to know what questions you wish researchers would answer. Because when I'm, as a researcher sitting here at UCSF and I come up with a research question, what are we going to study? I create that question and that whole research agenda and project out of what I think we need to figure out. But I want to know what patients and families think we need to figure out. That's why we need you guys. And I need to know, like, if we come up with solutions and they don't work, then what was the point, right? So we want to know what people who are living with the condition, or living with the people who are living with the condition, think would actually work in real life. We have meetings, but they're not like this. So the way we're kind of organized right now at the beginning is that in the middle we have this advisory council. Those are the main brains behind this right now. So the patients and the families are really important, right? We talked about that because you guys are going to help us orient to what's really important and what we need to be working on. The stakeholders are going to include everybody I showed you before. And yes, I think healthcare funders are an important piece of that. When you think about research, people think about it as there's sort of standard steps you go through, okay? And the idea is you start at number one up there with defining the problem. What is the problem that we're trying to solve? Well, we are at number one. We're at the beginning. So that's why I'm so happy you guys are here, because we need to figure out the problem is that we're going to research. And as I said before, I want everybody, all the stakeholders at the table when we think about the problem.
My name is Becky Higbee-Sumner, and I'm a child life specialist by training. I've worked at UCSF now for almost 18 years, and one of the best parts about my job is I actually run our Family Advisory Council.
I'm a parent by trade. I have 4 children. My third has significant disabilities. She's now 32. I'm also the Director of Support for Families of Children with Disabilities and support for families who have any kind of disability or special health care need, even kids who are at risk. There's no eligibility criteria.
California Children's Services is a federally, state, and county funded program, primarily federally funded program that supports children and their families, children who are low income and have complex medical conditions. They have to be medically eligible, meaning that they would benefit from specialty physician care.
One of the things that I have found that's really important is to establish some kind of group norms or ground rules for the day so that everyone feels safe and supported to express their viewpoints in a very comfortable and honest manner. And so I'm hoping you guys can help me to create those norms today. So when you think about group norms, what are some of the things that you think of that can make it a successful group experience?
Confidentiality.
Okay.
Just a focus on safety, that if someone's feeling vulnerable and they want to say something, that maybe they wouldn't feel so, just that we would create a safe environment and not react in a way that could make them feel vulnerable or
That's
always build up. I
Yeah,
guess.
that's so important, Ben. And as you can imagine, it takes a tremendous amount of courage and strength to get up in front of an audience and talk about your experiences. And I really just want to recognize that courage and strength.
I think it gives us a really nice starting point for the next activity that we're going to do at your tables. So what we're going to do at the next, and we have some worksheets. Right? The idea is that there's problems, there's things that aren't good, but there's problems that we don't know how to address yet. We don't know what to do. So we want to think about the unanswered questions and the problems that there's no answers for yet, that you want us to figure out. So I really appreciate everybody engaging, sharing their ideas, being open and honest and with their experiences, and really contributing their best thinking to what we're doing here.